Hi, my name is Dr. Elizabeth Stravinsky and I'm a Toronto chiropractor. I get asked all the time by parents, why should I bring my infant or young child to see a chiropractor? The answer is simple. It's about full expression of life. Just as for an adult, when the body is in mechanical or physical balance, then there's better overall functioning of your whole body and better balance in the nervous system. The nervous system is very important because it controls and coordinates every system and function in your body. When you have optimal spinal alignment, then that allows for optimal communication within the nervous system, which allows for better health and healing potential. One's best health is achieved by looking at the big picture. It's about being an active participant in your health by taking care of your physical body, mind, and spirit. Everything you eat, do, and think matters. What are some specific reasons for bringing an infant or young child to see a chiropractor? Wellness care is one of them. There are also several pediatric issues that respond well to chiropractic care. We tend to think of most commonly physical things, such as physical injuries, postural abnormalities. Screening for scoliosis is also important. But parents also bring their children for chiropractic visits for things such as ear pain, stuffiness in the ears and fluid buildup, asthma, allergies, digestive system abnormalities like diarrhea and constipation, infantile colic, enuresis or bedwetting, and individuals with these types of problems also benefit from chiropractic care. Just to clarify, however, chiropractors do not diagnose or claim to cure problems with the organs, so it is still important to see your pediatrician for appropriate diagnosis for this type of condition. What chiropractors do is we treat the physical body, and like I said, when the body is in physical balance, then that allows for better health and healing potential from the inside. If you look at this chart over here, this shows the autonomic nervous system. It's really cool because it shows the relationship between the spinal health and the rest of the body. The central nervous system, that consists of the brain and the spinal cord. And then there's nerves that come out at every vertebral level that goes everywhere in the whole body. So all of the different organ systems, the muscles, the joints, and everywhere. And like I said, it controls and coordinates every function. Obviously it's a simplified diagram, but it does show some very important relationships. For example, the nerve supply to the lungs originates from the upper back. The nerve supply to the colon originates from the lower back. If we're thinking about things like ear pain, ear stuffiness and pressure buildup, or eustachian tube dysfunction, the muscles that control the opening and closure mechanism of the eustachian tube, those muscles are innervated by nerves that come from the neck. So the whole body functions together. Everything is coordinated. The parts don't work in isolation from each other. The total result is greater than the sum of all the parts. The musculoskeletal system, the nervous system, the immune system, the digestive system, and all the other systems of the body, they all function in coordination and all function together. So when you have balance in one system, for example, if you have balance physically, then that can encourage balance in the rest of your body as well, and in other aspects of your health. The purpose of chiropractic is to identify areas of dysfunction and misalignment in the spine and to correct those misalignments. Chiropractic care is about facilitating the mind and body connection, and it's about restoring balance to the nervous system such that there's optimal communication and optimal health and healing potential from the inside. Where do misalignments come from? Misalignments come from all types of daily life activities and from physical, chemical, and emotional stresses. In infants and young children, this can come from birth trauma, it can come from tumbles and falls as one is progressing through their developmental milestones, sports activities and injuries from sports. Emotional stress can sometimes manifest as muscle tension, which can affect underlying alignment. All of these things are daily life things that lead to imbalances, and everybody can have them and not even be aware. What can you expect from your pediatric chiropractic visit? The first step is a detailed health history from birth until present. The purpose is to identify any stresses to your child's life and to your child's body, and also to discuss any health concerns that you may have. The next step is a physical examination, and the physical examination is used to identify any areas of dysfunction or misalignment. If any misalignments are detected, then the chiropractor will recommend a course of care. How does the chiropractor treat an infant or young child? Obviously, this is very different from how we would treat an adult. Very gentle techniques are used, which take into consideration the unique biomechanical properties of pediatric spine. Regardless of pain or symptoms, having a spinal health checkup is an excellent way to determine if your body is functioning at its very best. So find a chiropractor in your area, or if you're in Toronto or the GTA, come see me.